Despite Saturday pronouncements by government to procure 500 doctors from Tanzania being met with resistance by the Doctors' Union and the Kenya Medical Practitioners and Dentists Board, the importation is still on course, with the said doctors expected to report on duty by April this year.
I do not see any debate as far as that action is concerned. It is the right move, and we will continue to make sure it becomes successful so that our people can receive services.
While making an impromptu visit at Kenyatta National Hospital after it had recalled all 12 fire doctors as well as the 48 who were under scrutiny for disciplinary cases having participated in the doctor strike that lasted for 100 days, Health Cabinet Secretary Cleopa Mailu defended the government position to hire the doctors on contracts, maintaining that it was within the law.
Doctors from the East African community do not require exams, do not require double registration. Within the East African community protocol, especially for doctors, you can work in any country as long as you get a work permit. They are fully trained. The curriculum is harmonized. We know that inspection of medical schools is done jointly.
According to Mailu, the doctors who will be on 2 to 3 years contract will be posted in public hospitals to help address acute doctor shortage as well as improve health services in the country.
The doctors raised an issue of they are few in numbers, and also they work many hours. And that is the reason why we are trying our best as a government to reach out to our neighbors and other people who have surplus doctors to see whether we can complement the number we have in the public institutions.
Mailu dismissed claims that there are more than 1,400 local doctors facing unemployment, emphasizing that Kenyans should view the initiative positively and one meant to address the patient-doctor ratio, improved service delivery and working hours.
The issue of doctors are a very privileged group within the public sector. Those are the only graduates who get absorbed directly by government after finishing their medical school. They get a job. They have never looked for jobs. Therefore, anybody trying to create an impression in the Kenyan mind that we are bringing foreign doctors when ours are in the streets, that's an absolute lie. Any doctor in this country who is in the streets is by choice. They either resigned from public sector or they went to the private sector to eke a living. And they are welcome if they feel they want to come back to the much improved pay within the public sector.
The government maintains that plans to hire specialist doctors from Cuba are still underway. Meanwhile, the Ministry of Health has welcomed a move by the Ethics and Anti-Corruption Commission to access and file a report in regards to procurement of drugs following allegations of hike in prices of drugs. Linus Mwashigadi for Channel 1 News.